Many therapy treatment models for children involve a combination of the identified patient and then family counselor or social worker routinely consulting, teaching, and supporting the parents of the children or adolescents they are treating. That's why an important part of any child's mental health treatment is for the parents to participate in consultation sessions. Hi, I'm Kim Feeney with Butterfly Beginnings Counseling, and welcome to my channel. I'm a licensed independent social worker and a registered play therapist supervisor. I have over 10 years of experience helping children and families to lead healthier emotional lives. I would love to do this for your family as well, so go ahead, subscribe, and hit the bell for weekly notifications on the latest content. An important part of a child's progress in play therapy services is to have parents or guardians involved in the therapeutic process. Parent consultations are meetings between the registered play therapist and caregivers to discuss the goals and progress of the child. It is helpful for the counselor to hear how the child functions outside of the playroom in order to do interventions inside the playroom that will progress the treatment goals. These meetings are also a great time to share any changes at school, home, or within the community. It's also an appropriate time for the counselor and parent to team up to create parenting strategies or possible solutions to support the child even further. After the initial intake session, I personally generally meet with parents every 4 to 5 weeks or 4 to 5 sessions, sometimes less in the early part of treatment. Of course, this is always flexible based on the need, and the parent and therapist can determine together if more frequent consultations would be helpful for the family. Again, these meetings are the perfect place for parents to bring up any concerns, to discuss progress towards goals, and talk about any parenting wins and challenges that they're having. Your child's counselor will share any themes arising in therapy and progress towards the goals that they're seeing in the playroom. Parent consultations are also a fantastic way to help the supporters of the child come together and check in on what's working and what better ways they can support the child together as a team. Comment below and let me know what other conversation topics you would like to discuss with your child's therapist. And of course, clinical evidence shows that parent consultations decrease problematic behaviors in children and adolescents while simultaneously increasing parental confidence. Further, clinical data suggests that parents self-report an improvement in the relationship with their child. And as a parent, you're probably thinking, duh, this makes a lot of sense. Who better to help a child with their sleep problems than the parent who's getting up in the middle of the night? Who better to help a child with anxiety issues than the caregiver who braces themselves for an anxious meltdown before a birthday party? In the parent consultation treatment model, therapists teach the teachers who spend the most time in the parenting classroom: moms, dads, and caregivers. Another positive way to support your child's emotional health is to help them learn to co-regulate. You can learn all about this in my webinar for parents, Supporting Your Child Through Anger, Sadness, and Worry. You can register with the link below in the description. Of course, these parent consultation sessions are comprised of several different parts, and always begins with educating the parents on the presenting problem or the developmental phase that the child may happen to be in. Other common components of consultation include helping parents to confidently establish household routines, increasing positive attention to the child, parental perspective taking, and increasing overall parent knowledge and confidence in responding effectively to their child or adolescent. The therapist spends time in these consultation sessions reviewing scenarios that relate to the child's problems and gives parents an opportunity to practice ways to respond. In between sessions, the parents are asked to practice these responses throughout the weeks. The successes and opportunities for improvements are reviewed with the therapist the following consultation session. Now, at times, consultations may involve sharing pieces of your own personal childhood history, because your own history plays a part in how you parent your child today. You may also be asked to participate in experiential activities such as an art piece or a sand tray. Be open to these opportunities and invitations from your child's therapist. They really are a way to work together as a team to figure out the best way to help your child. Another important layer to parent consultation is helping parents address and understand their own anxiety, concerns, and beliefs about their child or adolescent's behavior. Addressing parents' own feelings, judgments, and personal coping styles can be an effective way of helping parents manage their own stress and thus model healthy coping for their child at home. I know for sure it's hard to remember discussion points in the moment. That's why I always recommend keeping a notebook or notes in your phone and writing down questions and problems you'd like to discuss with your therapist. This always gives you a starting point for each consultation session. If you come across an issue between sessions, just jot it or type it down, and then you have it fresh when it comes to the next consultation. One of the best benefits of consultation sessions is developing communication skills. These skills are tailored specifically to your family. Some families are quiet and reserved, while others are more vocal and opinionated. And no family dynamic is right or wrong. You simply just need to learn the best way that your family communicates with each other to cope with big feelings and deal with big issues when they arise. So, during your consultation sessions, ask for tips on how to improve conversations at home. Your therapist can suggest tasks, activities, and some small adjustments that will work well for you and your family. The more time you have in consultation, the better your therapist will be at attuning to your family's specific needs. Also, keep in mind, your child will feed off your energy and perspective. If you act resistant to these consultation sessions or therapy in general, then they will be too. So stay positive, keep an open mind about therapy and the whole process. Also, another thing to keep in mind is your child has the right to confidentiality. These consultation sessions do not include a play-by-play of everything your child says or does during their play therapy sessions. However, it does include a broad hypothesis based on themes and patterns that the therapist has observed throughout the sessions. Overall, these parent consultation sessions are an opportunity for your child's therapist to be working with you as a team to improve your child's emotional and behavioral concerns. After all, you are the expert on your child. Don't forget to register for our webinar for parents, supporting your child through anger, sadness, and worry, using the link below in the description. If you found this video helpful, give it a thumbs up, subscribe, and share with a friend. Until next time, wherever you are in your day, hug your child and make it a great one.